Module 6. Central nervous and head and neck. Questions. 1. A 20-year-old male presents with the inability to gaze upwards. CT brain shows moderate hydrocephalus and a rounded mass adjacent to the tectal plate. The mass demonstrates marked homogeneous enhancement and is not calcified. MRI confirms a well-circumscribed, relatively homogeneous mass that is iso-intense to gray matter on T2 weighted imaging. The mass is hyperintense on contrast-enhanced T1 weighted imaging. What is the most likely diagnosis? A. Germinoma. B. Teratoma. C. Pineoblastoma. D. Pineocytoma. E. Benign pineal cyst. Meningiomas to occur intraventricularly, 2–5% of all meningiomas, but they are the most common trigonal intraventricular mass in adulthood. They tend to occur in E. 90%. 140. Module 6. Central nervous and head and neck. Module 6. Central nervous and head and neck. Answers. 1a. Germinoma. Germinomas are germ cell tumors arising from primordial germ cells. They frequently occur in the midline, mostly in the pineal region but also in the supercellular region. In men, 80% of pineal masses are germ cell tumors, in contrast to 50% in women. They tend to occur in children or young adults, 10–25 years old. Symptoms depend on the location, but the case describes Parnot syndrome, paralysis of upward gaze due to compression of the mesencephalic tectum. Germinomas may also cause hydrocephalus by compression of the aqueduct of Sylvius, thus patients may present with signs and symptoms of raised intracranial pressure. Germinomas are a known cause of precocious puberty in children under the age of 10 years. They are malignant tumors and may show CSF seeding, making cytological diagnosis possible with lumbar puncture. They are, however, very radiosensitive and show excellent survival rates. Pineal teratomas tend to be heterogeneous masses containing fat and calcifications. Pineoblastoma is a highly malignant tumor, which is more common in children and usually has poor tumor margins. Refs, Dannert p. 320. Cyst. 2. A 40-year-old female is investigated for worsening headaches. CT shows a well-defined hyperdense globular lesion within the trigone of the left lateral ventricle. There is intense contrast enhancement. The most likely diagnosis is A. Choroid cyst. B. Ependymoma. C. Colloid cyst. D. Meningioma. E. Neurocytoma. 3. A 40-year-old female presents with 321, Sutton p. 1748. 2d. Meningioma. It is rare for meningiomas to occur intraventricularly, 2–5% of all meningiomas, but they are the most common trigonal intraventricular mass in adulthood. They tend to occur in 40-year-old females. Ref. Dannert p. 306. Bitemporal hemianopia. CT brain shows a large, slightly hyperdense supercellular lesion. The mass contains several lucent foci, and there is bone erosion of the cella floor. There is enhancement post-contrast. T1 weighted MR imaging shows a predominantly iso-intense mass causing cell expansion and compression of the optic chiasm. The mass contains foci of low and high signal intensity. What is the most likely diagnosis? A. Craniopharyngioma. B. Meningioma. C. Rath's cleft cyst. D. Giant internal carotid aneurysm. E. Pituitary adenoma. 4. 306. 3e. Pituitary adenoma. Pituitary adenomas are divided into microadenomas, 1 cm, and macroadenomas greater than 1 cm. Macroadenomas may present with endocrine dysfunction, but are generally less active than microadenomas. Thus, macroadenomas often present with symptoms of mass effect on the optic chiasm, or if there is lateral extension into the cavernous sinuses, patients may present with other local cranial nerve palsies. 3, 4, 6. The differential diagnosis of a supercellular mass includes SACHMO, supercellular extension of pituitary adenoma/sarcoid, aneurysm/arachnoid cyst, TB/teratoma, other germ cell tumors, craniopharyngioma, hypothalamic glioma or hamartoma, meningioma/metastases, especially breast, and optic/chiasmatic glioma. In this case, the cellar is widened and the floor is eroded, suggesting the mass arises from the pituitary itself. Low density/low intensity regions on CT/T1 MRI correspond to NEC. Rhotic areas and high signal foci on T1 MRI, found relatively frequently, represent areas of recent hemorrhage. Refs. Dannert p. 323. 4. When on call you are asked to perform a CT head scan for a 17-year-old male who presents with seizures. He is unable to provide a history. A look on the computer system shows that he has had previous regular abdominal ultrasounds and an echocardiogram as a child. Brain CT shows a hypodense, well-demarcated, rounded mass in 127. The region of the foramen of Monro. It is partially calcified and it demonstrates uniform enhancement. What is the most likely diagnosis? Diagnosis. A. Colloid cyst. B. Giant cell astrocytoma. C. Metastasis. D. Lymphoma. E. Hemangioblastoma. 5. A 35-year-old male presents with ataxia and nystagmus. 323, Sutton p. 1749, 141. 4b. Giant cell astrocytoma. The main differential for a mass at the foramen of Monro is between a colloid cyst and a subependymal giant cell astrocytoma. The latter is associated with tuberous sclerosis, TS. Renal involvement is also relatively common in TS, and patients regularly have surveillance renal ultrasounds. The echocardiogram was performed to assess for cardiomyopathy/rhabdomyoma. Other central nervous system findings in patients with TS include 1. Subependymal hematomas. These are nodular and irregular, and can be located anywhere along the ventricular walls, but predominantly occur around the foramen of Monro or along the lateral ventricles. In infants, with unmyelinated white matter, the lesions are usually hyperintense on T1 and hypointense on T2. The reverse is seen in adults. 2. Subcortical and cortical hematomas, tubers. These appear as broad cortical gyri with abnormalities in the adjacent white matter. They frequently calcify, but enhancement is extremely rare. 3. Heterotopic gray matter islands in white matter. These may calcify and show contrast enhancement. Colloid cysts are typically hyperdense on CT and show border enhancement. Ref. Dannert P. Nystagmus. Blood tests reveal polycythemia. CT head demonstrates a mass predominantly of CSF density in the posterior fossa. Subsequent MRI shows a largely cystic mass with an enhancing neural nodule. There is surrounding edema but no calcification. The most likely diagnosis is A. Metastasis, B. Pilocytic astrocytoma, C. Hemangioblastoma. P. 277, P. 331. 5. C. Hemangioblastoma. Hemangioblastoma is the most common primary interaxial, infratentorial tumor in adults. They are benign autosomal dominant tumors of vascular origin. Approximately 20% occur with von Hippel-Lindau disease. Other associations include pheochromocytomas, syringomyelia, and spinal cord hemangioblastomas. About 20% of tumors cause polycythemia. Typical CT and MRI appearances are of a largely cystic mass with an enhancing neural nodule. Edema may be absent or extensive, but calcification is rare. Prognosis is 85% post-surgical 5-year survival rate. Infratentorial pilocytic astrocytomas may have very similar appearances to hemangioblastomas, but some differences exist that can help differentiate the two. Pilocytic astrocytomas predominantly occur in children and young adults, are generally larger, greater than 5 cm, than hemangioblastomas, may contain calcifications, and are not associated with polycythemia. Ref. Dannert P. 292. Hemangioblastoma D. Choroid cyst E. Ependymoma. 6. A 50-year-old woman presents with visual loss. Examination reveals retinal detachment and an ocular lesion. On MRI, the lesion is hyperintense on T1 and hypointense on T2 relative to the vitreous. The lesion enhances post-gadolinium injection. The most likely diagnosis is A. Metastases from breast cancer, B. Metastases from lung cancer, C. Choroidal hemangioma, D. Malignant melanoma, E. Vitreous lymphoma. 7. 6. D. Malignant melanoma. This is the most common primary intraocular neoplasm in adult Caucasians. The typical age range is 50-70 years old. They are almost always unilateral and located in the choroid, although ciliary body and iris melanomas are not uncommon. Presentation can be with retinal detachment, vitreous hemorrhage, astigmatism, or glaucoma. MRI shows a sharply circumscribed hyperintense lesion on T1, due to the paramagnetic properties of melanin, and hypointense relative to the vitreous body on T2. Ref. Dannert. 35-year-old previously well female consults an ophthalmologist with a history of progressive loss of visual acuity over several months. Retinal examination reveals papilloedema. Unenhanced CT shows tubular thickening of the optic nerve associated with dense calcifications. Post-contrast injection shows a non-enhancing optic nerve surrounded by a markedly enhancing soft tissue mass. The remainder of the brain is normal. The most likely diagnosis is A. Optic nerve glioma, B. Perioptic meningioma, C. Sarcoidosis, D. Lymphoma, E. Multiple sclerosis. Dannert P. 353. 7. B. Perioptic meningioma. These tumors account for less than 2% of all intracranial meningiomas. They occur within the 3rd to 5th decades and are more common in females. They are also associated with neurofibromatosis type 2. They typically present with progressive loss of visual acuity over several months due to optic atrophy. 142. Module 6 Central nervous and head and neck answers. They are usually tubular in appearance, although fusiform and excrescentic thickening of the optic nerve also exist. Tumor enhancement around a non-enhancing optic nerve, tram-track sign, and calcification are highly suggestive of meningioma. Ref. Dannert P. 349. Sclerosis. 8. Routine first trimester antenatal ultrasound scan reveals a large posterior fossa cyst and ventriculomegaly. Fetal MRI demonstrates dysgenesis of the corpus callosum, a large posterior fossa, and hypoplasia of the cerebellar vermis. What is the most likely diagnosis? A. Dandy-Walker malformation, B. Dandy-Walker variant, C. Megacisterna magna, D. Arachnoid cyst, E. Poencephaly. 128. A. Dandy-Walker malformation. Dandy-Walker malformation is characterized by an enlarged posterior fossa, not seen in Dandy-Walker variant, with high-rising tentorium cerebelli, dys/agenesis of the cerebellar vermis, intact in megacisterna magna, and cystic dilatation of the fourth ventricle, normal in arachnoid cyst. Ventriculomegaly is also common. Ref. Module 6 Central nervous and head and neck. 9. A 36-year-old woman with known polycystic kidney disease presents with a history of sudden onset headache and has signs of meningism. A CT brain reveals subarachnoid hemorrhage with hematoma within the septum pallidum. What is the most likely site for an intracerebral aneurysm? A. Anterior communicating artery, B. Posterior communicating artery, C. A2 segment of an anterior cerebral artery, D. Tip of the basilar artery, E. Middle cerebral artery. Ref. Dannert P. 280. 9. A. Anterior communicating artery. A clot in the septum pallidum is virtually diagnostic of an aneurysm of the anterior communicating artery. Aneurysms of the distal anterior cerebral artery are less common. Ref. Granger and Allison. 10. A 68-year-old male attends the emergency department after being found slumped in his chair at home by a carer. CT head shows an intraparenchymal bleed. On MRI, the lesion is hyperintense on T1 and hypointense on T2, weighted imaging. Which of the following stages of hemorrhage best correlates with the MRI findings? A. Oxyhemoglobin, B. Deoxyhemoglobin. Allison P. 1313. 10. C. Intracellular methemoglobin. Ref. Bradley W. G. Jr. Mr. Appearance of hemorrhage in the brain. Radiology 1993, 189, 1526. D. Extracellular methemoglobin, E. Hemosiderin. 11. A middle-aged female presents with unilateral proptoses. CT of the orbits reveals an intraconal mass with involvement of the lateral rectus muscle to its point of tendinous insertion. The lesion enhances post-contrast injection. MRI shows a mass which is hypointense to fat on T2. What is the most likely diagnosis? A. Thyroid ophthalmopathy. B. Lymphoma. C. Cavernous hemangioma. D. Capillary hemangioma. E. Pseudotumor. (1526). 11. E. Pseudotumor. Pseudotumor is the commonest cause of an intraorbital mass lesion in adults. It is an idiopathic inflammatory condition, and about 10% of cases occur in association with autoimmune conditions such as retroperitoneal fibrosis. It usually presents with unilateral painful ophthalmoplegia. It can be acute, more common, or chronic. The former has a more favorable prognosis as it is responsive to steroids. In contrast, the chronic type frequently requires chemotherapy and radiotherapy. On MRI, pseudotumor is hypointense to fat on T2, whereas true tumors are hyperintense. Graves' disease is the most common cause of uni/bilateral proptoses in adults, 85% bilateral, 15% unilateral. However, involvement of extraocular muscles tends to maximally affect the midportion with relative sparing of the tendinous insertions. This gives rise to the so-called Coke bottle sign. Refs, Dannert p. 346, p. 350, Granger and Allison p. 1398. Stage Pseudotumor. 12. Which of the following best represents the decline in positive CT findings for a clinically suspected subarachnoid hemorrhage from scanning at 12 hours post-ictus to 3 days post-ictus? A. 90% positive at 12 hours to 70% positive at 3 days. B. 90% positive at 12 hours to 60% positive at 3 days. Center 98% positive at 12 hours to 90% positive at 3 days. D. 98% positive at 12 hours to 75% positive at 3 12. D. 98% positive at 12 hours to 75% positive at 3 days. Ref. Granger and Allison p. D. 98% positive at 12 hours to 75% positive at 3 days. E. 90% positive at 12 hours to 50% positive at 3 days. 13. A 20-year-old female is under investigation for periodic halitosis. A CT scan reveals a well-defined, hypodense mass located between the longus colli muscles. Muscles. There is no enhancement post-contrast injection. MRI demonstrates a midline cystic structure in the posterior roof of the nasopharynx. It shows high signal intensity on both T1 and T2 sequences. The most likely diagnosis is A. Benign polyp, B. Rax pouch cyst, C. Ranulas, D. Tornwald cyst, E. Thyroglossal duct cyst. P. 1311. 13. D. Tornwald cyst. Tornwald cyst is a benign mass typically located in the midline, between the longus colli muscles, in the posterior nasopharynx. They arise as a result of a focal adhesion between the ectoderm and regressing notochord. This causes the creation of a pouch, but when the communication with the pouch is lost, a cyst develops. Tornwald cysts are usually asymptomatic and are picked up as incidental findings. Periodically, the pressure within the cyst increases, causing the release of its contents into the nasopharynx. This leads to presentations including halitosis, foul taste in the mouth, and persistent nasopharyngeal drainage. Peak age at presentation is 15-30 years. Imaging features can vary depending on the protein content within the cyst, but typical features are of a well-delineated, thin-walled, midline cystic lesion measuring 210 mm in diameter. They are hypodense on CT, rarely calcify, and do not enhance. They can be high or low on T1, depending on protein content, but are high on T2 weighted imaging. Rax pouch cysts are located anterior and cephalad to Tornwald cysts. Ref. Salmon curtain page. "14. You are called by a pediatrician to perform a cranial ultrasound on a term neonate who requires intensive therapy following delivery. Ultrasound demonstrates a well-defined area of increased parenchymal echogenicity over the periphery of the right parietal lobe. What is the most likely diagnosis? A. Germinal matrix hemorrhage, B. Venous infarction, C. Middle cerebral artery infarction, D. Periventricular leukomalacia, E. Subarachnoid hemorrhage. Pages 1507-1508. 14. C. Middle cerebral artery, MCA, infarction. Vascular occlusive disease is rare in the neonatal period. When present, it is more common in the term infant and usually results from thrombosis rather than embolism. The MCA is most commonly involved. Etiology includes traumatic delivery, vasospasm due to meningitis, and emboli secondary to congenital heart disease. Ultrasound demonstrates echogenic parenchyma in the distribution of the arterial territory. Ref. Woodley H. Rethi Eld 5093b. Cranial ultrasonography in infants, common pathologies. London. Hemorrhage. 15. A 14-year-old boy presents with a progressive history of gait and speech disturbance. On both T1 and T2 weighted MR imaging, the globus pallidi are markedly hypo-intense except for a small central region of high signal intensity. The findings are more pronounced on T2 weighted imaging. What is the most likely diagnosis? A. Lees disease. B. Hallervorden-Spatz. London, Royal College of Radiologists, 2009. 15. B. Hallervorden-Spatz, HS, syndrome. The finding described on MRI is the eye of the tiger sign. This is closely associated with HS. HS is a progressive neurodegenerative metabolic disorder characterized by extrapyramidal and pyramidal signs. The condition, for which the pathophysiology is unclear, results in the accumulation of iron within the globus pallidi and brainstem nuclei. Two clinical entities exist, familial and sporadic. The familial, classic, form shows earlier onset and rapid progression. The sporadic, atypical, form is characterized by a later onset, often in teenage years, with slower progression. Although the eye of the tiger sign is closely associated with HS, it has been demonstrated in other rare extrapyramidal Parkinsonian disorders including cortical-basal ganglionic degeneration, early-onset levodopa-responsive Parkinsonism, and progressive supranuclear palsy. Ref. Gil-Erman R.P. The eye of the tiger sign. Radiology 2000, 217, 895-896. 16. C.